back to No Filter Needed at Verla Aesthetics. Today we're going to talk about the beauty blueprint and dive into a few little topics that people normally have questions about or feel lost when it comes to planning aesthetics or post weight loss and timelines. So we'll jump right into it. The difference between treatment plans of patients in their 20s and then our patients in their 40s. What would you do for the younger clientele?
So usually when a younger clientele comes in, their requirements or whatever they're expecting to get is completely different than people in their 30s and 40s.
Yes.
People in their 20s mainly looking for maybe some Botox, maybe some refreshment, mostly a little enhancement on the lips, not big on facial fillers. So when I have a younger patient, it's very important for me to assess them first and see if their expectations are realistic or if whatever
Correct.
they're looking to achieve actually fits or will look good on them, or will they have a great result with it. If it comes to Botox, I normally start with, you can say, preventative Botox. I start with lower quantity, lower number of units, just to maintain and prevent any wrinkles from
Yeah.
forming.
And especially to see their movement. And I feel like this is a very controversial topic as well because patients in their 20s, like, yes, number is an age, but everyone's skin and aging process is so different. Like, for me, instance, I'm 23 years old and what, you do 150 units of Dysport in my face,
Mm-hmm.
but I have so much movement. Like, I have bad eyes, so I'm always scrunching. I'm very expressive, so I just have a lot more movement. Whereas I've seen patients in like their late 20s that have like almost little to no movement.
Yes.
So,
So it's very individual. One thing that is very important to assess, specifically with younger patients, is to see if they have any lines, any static lines or dynamic lines. Static lines are really lines when you're not making any movement; they're just there. They're already formed. This is
they're
something
there,
they're there.
staring at you.
This is something we probably need to treat. Or if they have dynamic lines, which only form when they make movement, when they make repetitive movement, say raising the eyebrows and then a line form. Very important to assess these things and see if the patient is an actual candidate for Botox, because sometimes patients just want Botox, think it's good for them,
Yeah.
or
And I think too, when my younger clientele comes in, I think it's very important that I start off telling them that skincare is a necessity in their routine for anti-aging. A lot of patients will come in because they see all of these other influencers or celebrities coming in and doing filler all over their face. And to be completely honest, that is not the approach that I want to take, nor that you
right.
take. And we need to do this correctly so you have long-term results and retention rather than overdoing your face now because you want to look like everyone else or
Right.
just join the bandwagon and your skin quality is like shit, or you're still out in the sun not wearing sunscreen and it's just going to make you look worse.
Yeah.
So that's another thing with the younger clientele that I like to preach
Yeah,
about.
I feel like the combination for younger clientele is the combination of facial treatments, any facial that they need. As you said,
Correct.
depends on their skin quality.
My go-to is probably microneedling, maybe once or twice a year to
Mhm.
start off with. Um, you can even start laser hair removal. Some people have like lip, chin, but nothing too intense
Yeah,
because once you start things, you obviously have to keep up with
of
them.
course. When it comes to fillers with younger patients, this is also something that you need to see if the patient needs a corrective filler or a
Mm-hmm.
corrective lip filler, or they just want to enhance something that maybe they shouldn't. So, with younger patients, I feel like the majority of the time when I do fillers is mainly corrective. Say if they need more enhancement on their chin,
Mm-hmm.
or if they have very thin lips and maybe need a little bit of volume to make it look more even and more harmonious with their face. So this is something we can do for 20-year-olds. But when 20-year-olds, or people in their late 20s, even when they come with pictures of celebrities and they want their lips to look in a certain way or their face to look in a certain way, you always have to manage their expectations and explain to them that if they will do the same treatment, they might not have the same result.
Correct.
So yes, you can just go ahead and do a bunch of fillers to people that don't need it, specifically younger patients. But I feel like being genuine and honest and showing them and explain them why they shouldn't have a specific treatment is very, very important.
Yeah. No, it goes a long way. And I will say my generation, we're very stubborn. Like if before I was in the industry, I would go in and I'm like, no, I'm not going to look worse afterwards. They just have to understand that a little bit goes a long way. And especially when you're in your 20s, you don't have much collagen loss regardless.
Mm-hmm.
So it's really just tweaking those little things that is going to make you look younger and prevent the aging process
Right.
throughout. Now, when I'm treating patients in their 40s or 50s or 60s, yes, they could be keeping up with their skin throughout their whole life, but
Right.
as we age, every decade we lose a lot of collagen.
Right.
Every year we lose about 1% to 3% of collagen.
Correct.
So if you do the numbers, when you're in your 40s, 50s, and 60s, you have a lot of collagen loss.
Right.
So I would go in with probably a combination treatment of doing like a collagen facial on our
Mm-hmm.
YAG with Morpheus 8 and then sending them to you,
Right.
or actually doing Sculptra first, and then doing Morpheus and collagen facials to
Right.
produce as much collagen as possible. And then also those clients are more going to lean on your side for fillers and Botox because they are going to need that volume and symmetry at that age.
Right. When it comes to patients, in their 40s, 50s, as you said, it's a whole different ballgame. When it comes to Botox, I definitely go more aggressive because the movement is much more pronounced and the wrinkles are also much more pronounced.
Mm-hmm.
When it comes to fillers, what we see with age is our fat pads that we have under our skin and our face, they start withdrawing down.
Yeah.
Gravity. I mean, unfortunately, this is what happened with time and with age. And what we're able to do with fillers is balance that drawing down of the fat pads.
Mm-hmm.
Um,
Yeah, and the number one spot that you notice aging first is the jowls.
right,
It's always everyone's like number one. And
right.
then the loss of volume in like the
The
mid-lateral
cheeks.
cheek
Correct.
area.
Yes. So main target when I see the loss of volume in older patients is to target the cheeks, mainly on the zygomatic bone, to enhance the lateral cheekbones. And as you said, the jowls, because the
Mm-hmm.
jowls is really a big concern for a lot of patients because
Mm-hmm.
this is one of the things you're starting to see first with
Correct.
aging. So when we're correcting that with a little bit of filler, and you don't even need that much to correct that, we're correcting that and giving more harmonious look to their jawline, then they get more satisfying and pleasing look. This is
Yes.
mainly what they're looking for to
It's
kind of
like
rejuvenate.
we're trying to achieve the upside down triangle look again. So
Right.
I always say when you're young, your face is basically an upside down triangle. It's like you have your perky cheekbones and then everything just kind of like fades in. As we get older, that triangle turns right side up, which is not what we want.
Unfortunately.
Unfortunately, so that's what we're trying to correct is fix that triangle again. Also, in conjunction with skin rejuvenation
Mm-hmm.
treatments, anyone in their 40s, or honestly anyone above 30s, should be taking Simorelin on B12 if they have energy loss. I mean, if they're completely healthy and don't deal with brain fog or low energy or slow metabolism, then by all means, they don't need it. But everyone can benefit from Simorelin. I think it's a great peptide and it also works with anti-aging. So it
Mm-hmm.
helps with your skin texture, skin laxity, it makes your skin super
Yeah.
glowy. It also speeds up your metabolism. So our approach is fixing things from the inside out for aging just to get the best result and long terms as well.
Yeah. And consistency with that is also a big key factor. Those type of supplements are amazing. They're great. As you said, they
Mm-hmm.
have amazing benefits. But you also have to be consistent with it to actually see
Correct.
a result or to feel some sort of change. Because a lot of patients just take one shot, two shots. They feel a little bit of change, but
Yeah.
it's a
That's when
key.
I'm very hard with them up front. I'm like, listen, if you are not going to be consistent or
Mm-hmm.
like invest in this as much as I want it for you, then you're probably not the right client for me.
Yeah, correct.
Because it's frustrating. Like, especially one, you're spending all this money, which, like, obviously the money isn't what I'm trying to take from you. Like,
Hmm.
you come in for a reason. I'm trying to give you results. And if you're not going to do it,
Right,
then, like, why are we here?
right. I feel like in both what you do and what I do, taking care of our patient is really our
Our
art,
job. Yeah.
our job and our art.
It's
We
our
take it as
work.
a project, and we want to see the patient succeed. We want to see the patients looking better, feeling better, and
Correct.
it's also a big key that the patients will do the same and will cooperate and will listen to what we recommend.
Especially everything we do here is non-invasive or minimally invasive,
Hmm.
and it's so important for estheticians, owners, medical directors, NPs, injectors, that you tell them straight up and
Hmm.
are honest from the jump, and then that client is with you forever because they
Right.
appreciate that
Right.
rather than beating around the bush.
Exactly. Talking about consistency, I see recently with a lot of my patients that were on semaglutide for a long period of time that are having some problems with skin quality.
Mhm.
What would you say that are good ways or good methods, good techniques to use while on semaglutide to prevent the droopiness of the skin or the
Yep.
loss of collagen from the skin because of the very, very rapid weight loss?
Yeah, so as you guys know, weight loss injections, Ozempic, Mounjaro, Sema, tirzepatide are huge
Hmm.
in the industry right now. And I think it's super important to be doing combination treatments with that because when you're losing so much weight rapidly, even if it's not too rapidly, you're still going to be left with that loose skin.
Right.
And that loose skin, it's harder to correct once it's completely been done, rather than when you start losing weight, you want to correct it as it's going
Hmm.
because it's never going to get to that point where, I mean, I've had some patients that literally have to go get surgically like tummy tucks because they've lost so much weight and they just are left with like all of this loose skin, which yes, Morpheus 8 can help with that. Yes, Sculpture can help with that, but it's not going to be the result that they're looking for because
Hmm.
they just let it go for 6 or 8 months and now they're
Right.
left with all of that. So my recommendations for all of our weight loss patients is if it's someone losing 5 or 10 pounds, like they probably don't really need a combo treatment. But if we're talking 20, 30 pounds, depending on the area, absolutely Sculptra.
Hmm.
Sculptra should be getting done
I
regardless.
agree.
At least 2 vials just for like maintenance. And if it's body areas, I mean, you can still do Sculptra and like knees, elbows, things like that. But Morpheus, hands down, like
Hmm.
we want to be creating that new collagen and tightening up that skin while you're losing that weight, so you're not going to be left with that loose skin at
Right.
the end. No
Yeah.
one
Yeah.
wants to get to their end goal of weight loss and achieve that and then they're left with this loose skin and now it's another issue. So we want
It's
to
a
try
big
to
issue.
keep it in a combination and treat both things at once, so I'm happy, the patient's happy, and you're killing two birds in one stone.
Right. It's just the other day, actually, I had a patient, 28-year-old, very young, that lost about, I think, 60 pounds on semaglutide.
Oh my gosh.
And she looks great, um, but she has a lot of loose skin, especially around her tummy. And she asked me, what can I do? And the problem is that after she already lost all this weight and she has all this loose skin at this point, there's not much
Yeah.
we can do, even with Morpheus, even with Sculpture, whatever it is, uh, but surgery.
Yeah.
So,
And I kind of coach my patients. I mean,
mhm,
obviously, I'm not a trainer, but you can only tell them so much. I preach that lifestyle is a big thing too. A lot of patients just rely on GLPs and don't change their lifestyle, which when you are working out and eating healthy, it's way harder to be left with a lot of loose skin rather than if you're just like a couch potato taking a shot every day just to lose weight because you're
right,
lazy. We put in our work, the patient puts in their work. It's
right,
not that hard. It's super easy, and you get very great, incredible results.
right. When it comes to my treatment, as you said, Sculptra is an amazing tool that we can use
Mm-hmm.
to tighten up a loose skin. But It's very limited also. We can do it on the face. It's great for the face. It's great for tightening up the skin in the face. Um, Even with rapid weight loss and a big amount of weight loss, we can do that. We can do that also on the elbows, on the knees, as you said. But there's areas that we can. So this is why maintaining while being on semaglutide with, say, Morpheus treatments or any
Mm-hmm.
laser tightening treatments is actually a big factor in improving the skin quality even after all the weight loss.
Yeah, agreed. What is your ideal treatment timeline for pre-wedding?
Pre-wedding, okay. Um, Pre-wedding, we'll start with Botox.
Mm-hmm.
When it comes to Botox, I think majority of the patient knows that it takes about 2 to 3 weeks to fully kick in. You'll
Yeah.
start seeing results in about 3 days, but the full effect of Botox will be within 2 weeks.
Mm-hmm.
I normally recommend to do the Botox probably about a month prior,
Mm-hmm.
so we'll have a little bit of time to correct if anything needs correction.
Yeah.
Say if one area was affected more, one area less, we can just touch it up. If anything needs to be lifted more, we can do
Mm-hmm.
that.
I
So
would do that too, like when patients have already had Botox, if they've never done
uh-huh.
any like treatment before or a neuromodulator, I always am like, okay, once you pick your wedding date, start.
That's
Pretty
true.
much.
That's true. That's true. It's actually a great idea. You can start even months ahead. You probably will have to maintain it after
Yeah,
that.
no, absolutely.
But if you start months ahead, you already know how your face is reacting, how your skin is reacting. So
Yeah.
that can also
I
be a great
only say
idea.
that because I did have a patient once who it was her first time. And you know, if you've had Botox before, you know the first time it can feel a little weird because you've never been like stiff.
Hmm.
So she was like freaking out, even though her face looked beautiful, but she was just like, why does it feel like this? I've never felt like this. Like I'm stiff, like I can't make expressions right now. So I'm always like, okay, if you've never had any neuromodulators or even like Morpheus or like microneedling, like start way in advance.
Yeah, yeah. You should start way in advance. I mean, we're talking way in advance. Probably you can do it a year prior,
Yeah.
you can do it 6 months prior. But if we're talking about crunch time, say we have only a couple months left, what are
Yeah.
we doing? Then I would say at least a month prior.
No, agreed.
Now, when it comes to fillers, fillers is a whole different story because fillers, you would see
Yep.
the effect of fillers immediately, right?
Mm-hmm.
But you will bruise and you will swell, and you don't want to bruise and swell too close to your wedding
Yes.
because that's not going to be anything you would like to see on your pictures after.
No.
So I would say with fillers, probably 2 months ahead.
Yeah.
2 months ahead, if you can't even three, because fillers tend to last about 6 months. You can do it a little bit before, but you have to take the time of bruising and swelling.
Yeah, no,
And
absolutely. It's not worth the risk, especially to plan so much for your wedding day that like
right,
the last thing you want to do is like rush when it comes to aesthetic treatments. So
correct,
I always tell patients, as crazy as it sounds, like if you have a wedding planner, like literally add in your aesthetic treatments to the wedding planner and like
right,
set up a timeline on like, okay, I need to start now. I need to do this. I need to do this because all I know is if it was my wedding day and I
mm-hmm.
was like, okay, I need my filler done right now or I need my Botox and it wasn't like exactly the way I wanted it
Right,
or I'm still bruised, like I would be a miserable human
right.
being.
And it's not only for wedding, right? It's even if you
Correct.
have
For
any big
any event.
event, yeah, anything big that you're planning for and you want to look good for, you
Yes.
should have all your soldiers in place because you will have some side effects. You
No,
might need
absolutely.
corrections. So you need to plan months ahead. And it's unfortunate that some people will come to us a couple weeks before their event, and I would say, I'm sorry, but you don't want to do it right now
Yeah.
because you might look better in a few weeks now, but for the date of your
It's
event,
cutting it too close.
yeah,
When it comes to skin rejuvenation, I normally for a wedding, I mean, it all obviously depends on the concerns that they're dealing with. So if it's mainly just preventative and correcting and they just want like nice, glowy glass skin,
mm-hmm,
I'll do microneedling.
mm-hmm.
Um,
How long before would you
like
recommend?
I'd probably do 8 months before
Okay.
and then another session 2 to 3 months before the wedding, 2 weeks from the wedding day. I normally will go in with like dermaplaning and a nice facial, maybe with like a little enzymatic peel, just to give that nice glow. And then a week of the wedding, I love doing like a glutathione shot just so their skin is super nice and
Yeah.
refreshed. Now, when we're dealing with if someone has a lot of pigment and they want the pigment to be gone, then I'll go in with probably like a photo facial a month before the wedding just
Hmm.
so it's nice and fresh, and then go in with the same protocol of a facial.
Right. Yeah.
Another topic that is very common is post pregnancy or breastfeeding treatments that they can be doing.
Hmm.
And they're always like, what can I do? When can I start doing this? Like right after my baby. So, what is your approach on treatments post pregnancy while they're still breastfeeding?
Right. So normally, either Botox or filler, if a patient is still breastfeeding, it's an immediate no.
Yeah.
Um, that topic was not well researched because I don't think there's anybody that will want to subject their babies for any research on of that type.
Mm-hmm.
But because it's so unknown and we don't know the repercussion or the side effects that can happen with fillers and Botox while breastfeeding, it's just an immediate no.
Correct.
If a patient is coming to me and she's still breastfeeding, I would tell her we need to wait at least 2 months after you stop breastfeeding because
Mm-hmm.
there's also hormonal changes to your body after
No,
stopping
absolutely.
breastfeeding. So you would want to wait at least 2 months. And after that period of 2 months, we can come back, we can reassess, and then we can treat.
Yeah.
But before that time period, I definitely don't recommend any treatment or any procedures done.
Yeah. I, for skin rejuvenation, so when it comes to laser hair removal specifically, post pregnancy and breastfeeding, I normally don't like to treat at least 3 to 4 months after. One of the reasons is obviously hormonal changes.
Hmm.
And when you're going through hormonal changes, hair growth occurs. So your laser results are not going to be effective. It could be all over the place. And two, the same thing. Like, I like to stay away from YAG, any type of laser while you're breastfeeding. In worst case scenario, after the 3 to 4 months, I just have their PCP write us a note and just say, like, she's good to go. Now, when it comes to skin rejuvenation, yes, they can start doing facials and stuff again,
Which
but
facials would you say is okay?
start off with our platinum facial. Probably not use anything super aggressive like a lot of AHAs or BHAs just to give the skin like a nice little refresh. Depending on what their skin is looking like, something that can happen post pregnancy is melasma. So, if someone does develop a lot of melasma, typically it's like a little mustache, or sometimes they can get it on their cheeks from post pregnancy. Then I'm starting them off on lightning treatments, but enzymatic, so not too super aggressive. Either way, with that, I'm still gonna wait probably 2 to 3 months after.